in the kit and how I would set it up. So let's just tidy up again. So that's my size, we can use that. That's good. Let's put all of that away. So I'm going to play the role of the dirtiness, and then I go and become a scrub nurse, okay? Just quickly. So I'm the scat nurse. This is the kit that we're going to use, and this is the main nurse's station. This is the main surface where I want to have the biggest. Yeah, no, coming. The biggest plate. So I've looked at the bag. There are no holes. This is intact. The sticker is the right color. So I'm happy to open this. Don't use scissors because you can accidentally cut things that are inside. These open up fairly easy unless your name is Anna and you break everything. So hopefully this goes. Right. Okay, open. Obviously the surface has been cleaned beforehand. I'm just pushing it out. Now, you can use this as a bin bag if you want. I choose not to, but a lot of practices put this here and they use it as a bin bag. For me, I'm a klutz, it won't work, and I try to get things into this and I won't be able to aim, and then I fiddle too much. But you can use it as a bin bag if you want. Okay, so you open it now. So obviously I have gloves on, right? Normal gloves, not surgical gloves. Normal gloves. Open it. This is what the scrub nurse is going to use for the draping. Put it here, this side up. Now at this point you can either leave it like this or you can open it. It's up to you what you want to do. You can pull this out and open it so that this scrub nurse only needs to open the inside, so you can pull this out, open it. There's another triangle here. There's still 2 more layers before you get to the sterile style stuff on the inside. Okay? If you do this, it's because your scrub nurse is already scrubbing. If I am doing this and then I'm going to go scrub, I don't do it. I keep it closed. And then I come back and do it. Because as soon as you open it, you want to use it. You don't want to set up for more than 15 minutes before you actually start doing surgery. So don't, if you have an empty room and you have some spare time, you have surgery in the afternoon, don't set up the room before lunch. Set up the room 15 minutes before. So the patient has arrived, you've gone through post-op, they're happy. They come in, they get injection, they get all of that in my practice, then they go out in the waiting room, then we set up. Okay? We want the contamination time to be as short as possible. Okay, so I'm allowed to touch all of this because this is all going to touch the dirty stuff. Now, look, the bulk of my stuff are all the way here. I don't want that there. No, I want it to be in the middle. So I move that. Okay, great. If you have kits, like I mentioned before, when you open it, it looks like this, and multiple of the kits look like this, I would suggest that you contact the suppliers and say, can you fix that? Because you want it to be closed, overlapping like this. Nothing on the inside is exposed when you do this step, okay? So now this stays like this. I go and I do my hands. I don't need to show you that, right? Because we do the. So I've done my hand, obviously no watch, of course. My hands, before I get my hands wet, I open this, I do my hands, then I open this bit, or you can open it beforehand. The reason I like to do it at the end is because this could splash depending on how close it is to your sink. Okay, I take it out, I dry my hands as we talked about, then I get my 1 towel per hand, remember? I drop things on the floor. I don't put it here because I'm going to put my scat nurse comes in and opens the gloves for me. So it puts the gloves here. So I don't want to have these dirty stuff here. So that normally we drop it on the floor and then we kick it to the side, and then that gets cleaned up. That's the only time in life that you're allowed to be messy and drop things. So this bit goes towards my neck. The little pockets here, you go in with your hands and hold tight to the top. So my fingers go around and I have full control of my gown. Hold the top and then I open. Open, elbows in. I don't have anything that can contaminate. I keep it up here and I let go. My elbows are in. Not always does that happen. Doesn't always unfold. Leave it. Don't shake it. Resist shaking. Okay, then you go in to the sleeves. Okay, so I'm a little bit stuck. I'm like, oh my god, that's okay. Okay, now I need somebody to come in and do that for me. That's okay, I pretend that I have somebody. So somebody comes at the back and ties that for me.
You want me to?
Okay, that's okay, you're filming, that's okay.
Thank you.
You saw that on the video and you have that step by step, right? So you don't fiddle because the person at the back is doing all of that for you. They tie it for you, okay?
Do you want me to tie it?
Just quickly, yeah, just, you don't have to tie it, just do the top.
There you go.
Okay, thank you. That's it. Okay, my fingers are still covered. Okay, just like that. Now I'm opening this. I want to know, you can come closer if you want.
Yeah.
There is right and left. Get your size measured before so you know what size you are. Okay, a little bit of my fingers showing, not the other hand. I pick up the gloves, put my fingertips in, put my thumb through. Now if my thumb is like this and I'm in here, okay, just get the thumb out a little bit. So, just because I fiddled with it. My hand was right, I fiddled with it. Okay, so this is a good example. I'm fiddling. Sometimes you have to. Don't panic. Don't panic. Just take a deep breath, slow down, figure out what's happening here. We are very used to using all our fingers. We're very good at it. My husband says that I have monkey hands and monkey feet. Which is true. Thank you. So I go into that pocket. I'm struggling to get my fingers out. That's okay. This is a steel glove, not a problem. I get my fingertips out. Where is the thumb? There. Now with this hand, I actually go all the way up. Now this in surgery will annoy me. For me, look at this. Got all the fingers wrong. That's okay. My brain is used to this going up to here. This is secure enough, but my brain during the whole surgery will feel like I don't have a glove because it's used to having this over. Now I'm going back and I'm going here. Pull it up. Okay? That's it. Don't fiddle more. My fingers are easy. I can work. This is fine. Not a problem. Get over it, Hannah. This is secure enough. There's no risk of anything happening. But my brain likes this because I know that I'm hugging. This is secure. I always know that my sleeve is here. I'm not showing my wrist. Okay? Now I'm coming here, so obviously I have a scat nurse helping me. I go on the inside. Why? Because the outside has been touched by the scat nurse. So you go on the inside, pull it out, and you can stick it on the wall, or you can tip it over. Okay? And then you still go on the inside, learn to always go on the inside of things. Always stay on the inside. Think that the outside is dirty. Always on the inside. Hold the stand, always on the inside. Always on the inside. Put it down. Now my scat, I would leave this. My scat nurse will sit down and pull this down. Because if I start fiddling with this, then I can contaminate. Or I can tip this, get lopsided. So this goes up, or it goes down. Leave it. Okay, this goes now to my surgeon. You can put it on top of that. The surgeon is going to use that. This is my section. This is for my patient. This is the thing that I'm going to use last. Okay, so that goes there. What do I have here? What does everything go? Now, if you're using a kit that has these biohazard bags, and if you have a big biohazard bin that you're using all the time and you don't really need this, you can utilize it as a sheet. So this can actually, because it has a sticky tip, this can actually go over that. If you already have a big bin that you're using anyway, this can go over that. If you want to put this over here in this kit. In this kit, we don't have a keyboard sheet. You know, we don't have that sheet. So say that in this kit, I'm looking at my room, and we have already decided that, okay, this is my nurse's one, the dentist only needs that, and then we have the surgical motor that we're going to use. And I'm going, okay, so what can I use in this kit to cover everything? So I'm definitely going to take an x-ray, yes, because I'm putting an implant in, and I think I'm definitely need to take an x-ray, or I'm doing an extraction, and most of the time I like to take a mid-extraction x-ray just to see if something has broken or something. Say, whatever your protocol is. So I want to cover that. I definitely have to cover this. Which one is easier to use over here? These are the things that you have practiced with your kids before, remember? So you have done all of that. So I'm going, okay, so this is the easiest to put over here. So that's what I'm going to do. The way that I think we should do it is to go on the inside. If you have kids, little kids, this is how we dress them. It goes over their heads. And then you go, so my hands are always protected on the inside. Done. What did I do wrong?
You didn't take the suctions out.
I covered everything that I need to use. So my scat nurse has taken this off. Put that here. We have taken this off. Put that here. This we're not going to use. We put it there. I think this is one of those chairs where you have to turn it off. Sorry, this one just makes noise. Are you guys okay if it makes noise and I talk over it? Okay. So this is what my scat nurse has done. Put it over. Retrieve it. I go in with this. Put it over here. Right? This is for my x-ray. I'm going, okay, this is where I'm going to hold on my sections. I have my surgical motor there, so that's too much setup. That's not how we start. And I'm looking and going, okay, so this is going to be over there for the surgical motor. We are short of, could be short of a sheet. So this is going to go on the side there. That's going to be a working surface. Or if your room is closed, small, and that is close to your chair, then you can use that as your surgeon's surgical site as well. If not, I'm looking at my kit and going, the only thing that I have left is this. And I have this surface to cover, and I have the keyboard to cover. Right? Okay. The reason I'm choosing that one for my surgical motor is because it has a sticky tape on the side. So I'm looking at my kits and I'm going, how can I utilize what I have? So what I did in one of the practices was that we said, we said, okay, they didn't want to change the kits. We said, what can we do to utilize what you have? So we looked at this and we said, okay, well, there's plastic here on that side. Let's see if we can separate this plastic from this sheet. And you can actually quite easily. It comes loose without scissors. You can actually take it off. So we make 2 out of 1. Can you see? If you don't have a Mayo tray in your practice, well, you have to be careful, right? So I want everything to be on this side, not touching anything.
What's this one?
This is a Mayo tray cover.
Oh, okay.
Okay? But remember, I'm saying that I don't have a cover, I don't have a plastic sheet for my keyboard. I'm going to need my keyboard because I'm taking x-rays. I don't want the scalp nurse to come in and take x-rays because I'm going to put a cover on that. So, this is when your perfectionism has to take a back seat. You have to go, okay, everything. I don't want to touch anything. What am I touching? What am I touching? I don't want to touch anything. This is DIY. But you practice these things. Okay. So I have now 2 sheets. Just to keep it in place. This is now going to be, instead of my see-through big sheet that I had. Where's my keyboard? My keyboard is somewhere here. I'm going to put this over my keyboard. Right? Okay, that's my keyboard done. I'm going back here. Look what I have here. For Mayo tray, this has a barrier at the back because this is going on top of the Mayo tray. All that plastic did was serve as a bag to hold it in place. It's sterile. It's not necessary for barrier for this because this already has a barrier. So I'm going to use that for here. My scalp nurse sits underneath and clips it together.
Sorry, the scalp nurse carry this one here.
Clean,
Okay.
because this is sterile.
Okay. So if a scalp nurse carry,
Scalp nurse sits underneath
should be
and
like
hooks
this,
it
right?
together.
Oh, okay.
So I don't do this, the scalp nurse sits underneath and just hooks it together so it stays stable. I don't have to, but I like security. Because look, it has the handle, I can hold the handle, I can move it back and forth. So I made something, I don't have a Mayo tray. I need something for my keyboard, so we created that something for my keyboard. So if you know what it is that you're doing, you can actually make things work in the kits, with the kits that you have, so you don't actually have to buy an additional kit. And then this can go over your x-ray. And it has a little sticky thing as well, so you can actually tape it together. So I want you all to practice that. Okay? And then we have this. Do you want me to show you how we do that?
Oh, yes, please.
Yeah? Okay. We're pretending that I am the dirty nurse. This doesn't go in. This doesn't, because this is all sterilized. All of this is sterilized. Okay? So we say that this is all sterilized. It's not here. My scalp nurse has left me with this. I like to put it on the side here, close to the edge. As close to the edge as possible. So when they set it up, that's how they set it up. Okay, and then we put everything on that side. So this is what I'm coming to as the clean nurse. One thing at a time. And my okay, so nurses are so much better than me at this. I don't want to cover that hole because that's where the thing gets plugged in. So I'm going, okay, well, let's leave that. If you have a drawer that misbehaves like this in your practice and you need to cover over and it opens, tape it. That should be on your protocol. Tape the drawer. Have a picture, tape the drawer beforehand so it doesn't keep opening. So I'm like, oh, okay, well, that's going to cover. Okay, so I'm going to leave that as it is. Because I can always go from underneath, or my scat nurse can sit down here and pull it off. But I'm thinking ahead that if I tape over that, I'm not going to be able to connect the handpiece. Okay, now let's do the side. So we have this one with the sticky tape. Opens like that, and then opens like this. This is a bit too big, so I would prefer a smaller one, but that's all I have in my kit. So this is where I want to be, right? So I go, okay. Now, I have that sticky tape here, and I go, okay, so I don't want to contaminate my fingers. I'm just going to drop it here and let it go. Did anybody see me touch the cable? I did, so I was contaminated. Okay, now I'm pulling this off, pulling the tape off as I am sticking it here, and then I don't need to stick anymore. I leave it like that. Now I go on the inside and open up, go on the inside and open up, and I go, oh my god, I got stuck. What do I do? I don't want my scat nurse to go on the inside, on that side. I go, that's okay. Go on the inside. Can you see? I'm still on the inside. Go on the inside. Go out. Fold it out. Leave it. Leave it. It's not perfect. Leave it. It's okay. Now I go and get my, this is all sterile. Okay? This is all sterile. I can touch it. I put it here. I put that here. Now, I can either try to do this myself, or I can give it to my scat nurse and say, can you do it? It depends on how good I am at hitting the target. It's not bad. You can leave it like that. Don't fiddle with it. It's okay. I'm going to have nightmares about all of this. Okay. Now, do you want me to show you the section? Are you okay with the section? You guys are okay with the section?
Yes.
This is your best friend. Do you have that in your kids? This is your best friend, honestly. It's so light. It's so easy to use compared to this. Heavy and stiff. So this hand is scattness, this hand is cleanness, okay? It's not one person, we're two people here now. Dirtiness, cleanness, scattness, scrubness. I give this to the scat nurse. I'm holding this side. This is now the scat nurse. Puts it in. I, as a clean one, don't want to do this because I can contaminate myself. The other one can do that. Push it in. Put it in. Make sure that it's really secure. Now, in your surgeries, if you need a connection, get that connection. So practice. Take one of these home with you and check so that you don't have to open your other kit. Now, this goes on, hangs over there. So it's on. I put this on so we're ready. And I try to keep as much of it as possible above ground, and I secure it. Not very well clearly. Practice with that. This is why you want as little walking around as possible. You remember those clips that I told you? Have an extra one, a big fat one. Just clip it together. Make life easy for yourself. Okay? But I don't want to have the scalp nurse walking around here. I want the scalp nurse there, and she or he stays there. This is my area, so I am aware of the fact that this is a bit flimsy. But if I have other people walking around here, then that's going to contaminate this, or it's going to risk throwing this off. And then with this one, we did a tubing over. So the tubing over is very easy. In your rooms, in your cubicles, if this happens, turn the chair off. The chair doesn't need to be. Just get it in the position that you want and turn it off when you're using this. These ones that you have in these kits have two sticky tapes. Okay. Take your time. Okay, pull this off and go, okay, well that's one. They're quite useless actually. And then what is this one? Where does this one go? Okay, let me pull it off. Let's see where this one goes. Don't panic. Okay, both of them came off. Okay, where does this go? Take your time. Here I've got, okay, there's a hole here. There's a tip here. So which direction would it go? This way. Goes on there. I go up here like this. I hold it, pull it down. I'm holding this. I'm pulling it down over my suction. The scalp nurse just sits there at the bottom. I'm going, and then I'm going, okay, now I can drop it. The reason I'm going quite far down before she or he takes it is because I'm looking at all this distance is probably what I'm going to touch. Anything beyond this, I'm not going to touch. She or he is only going to touch this anyway, but in case they touch that, that's okay because that's going to fall on the floor anyway. So I'm holding this bit really tight, this whole thing connection really tight. They're pulling it down. They pull it down. I don't start fiddling with this while they're pulling because we can get a disconnect. So I'm holding this tight securely. They're done. Are you done? Great, thank you very much. Now I'm taping. These tapes are not great. Here is another one where you can use a little clip over to hold it. I have my connection here. I tape above and I tape around that connection. If this accidentally comes off, disconnects, everything is within the bag. We can connect it. And then this goes down. These, I don't know if you guys can put them on your handles. If you can, good on you. I admire you. I can't. Now let's see with this one here if we can put it through. So I'm seeing that I have a sticky tape here. Let's see. Let me come around. Let's see. Can I put this through? Which direction do I want my X-ray to be? That direction. Let's see. Can I get this through? So you're practicing all of this before your surgery, right? Because this is a one-man job. At this point, it's a one-man job. Like, okay, I'm on the inside, okay, I'm on the outside, great. Now I'm thinking to myself, did this touch that? Can I touch this sticky tape? Can I not touch this sticky tape? Doesn't matter, because I can always use my clips. Now the most important thing before you tape it is to tilt it. You should tilt it. It's kind of like the patient opening their mouth. whatever you put before you secure it on the x-ray, tilt it to the position, this position, which is what you're gonna use it for, and then go, okay, so I need to take it here. And it stays like that. Take these to your practices. Practice them, try them, because you might like these kits and might want to use these kits. With this kit, I use everything in this kit. My kits are more comprehensive, I have more stuff in my kits, but this is perfect number of stuff, and I even have now these extra that I'm not using, and I have covered everything that I need to cover. Any questions? With these ones, the same. This goes around the neck of the patient, so you need to be familiar with your kits. They have a sticky tape here. It doesn't go around the chin, this goes around the neck, and this goes on the shoulders, so it doesn't glide. So you stick that around the shoulders of the patient.
Sorry, could you show me how to hold it this way?
Always,
If
whatever,
patient here,
yeah, whatever you
then-
do,
yeah.
whatever you unfold, whatever you open, you need to have full control over everything, all aspects of it. So say this is the position of the patient,
Yeah.
and this is the height where I want it. The patient is here. So I open it and I'm holding both sides. I'm not letting go of any side. Then I'm going, okay, so it's not fan folded at this point. This is how I'm opening it. Okay, and I think. This goes towards the head. Okay, so I need to stand here. Great, my scalp nurse is there. Okay, great. This is how I want it to be. This is where I want it to be. These are the sticky tapes. Now, I need to give some end of this to my nurse. How am I gonna do that? This is tricky. With this one, this is tricky. I'm going, okay, not a problem. I go here, and I hold this bit, and I hold this bit. I'm over the patient's head, nothing is touching anyone. I say to my patients, close your eyes. Just enjoy the music. Close your eyes. I'm holding this and I'm going, okay, so we need to open this. How am I opening it? This is not fan folded because it's not big, so it's just folded. I'm still holding it over my patient's head because I don't know which part of this I need to touch. At this point, I'm not confident enough to give anything to my nurse. All the time I'm holding this side, right? So I'm just opening sheet by sheet, and I'm going, okay, you can take that. That's it. I come back to my place. Nothing has touched anyone. I go, they pull it down on their end, gently. I'm standing here, nobody pulls too hard. I'm standing here, and I'm going, okay, that's perfect. Now I start to take the sticky tape off on both sides, and I go over the patient's neck, rest it. Now at this point I can rest it on the patient, and I can pull this off, and it goes down. You can go all the way down and hook it together, or you can just touch their shoulders so it sticks. I don't like to stick too hard because the patients feel a bit claustrophobic, and that's when mistakes can happen. I want to have some movement availability for the patient. These are those holes that you can use, but they can easily come off if you lean too much of them on them. So those things that I was talking about, you do this, stick it, you can use clips, you can do whatever you want. And then you've created a hole so that your suction goes through here. Then you don't go up and down. So if you use that, yeah. So now that section, if you want to use these holes, you want to use both of them, so then you go down and then up. But if you want to use, if your sheet doesn't have these holes, that's okay. This is my section. Here, clip.
Okay, I see, yeah.
And you can make it as tight or as loose as you want.
Okay.
But it's sitting on. This is not sharp. You've told the patient that we're going to have a few things on your chest. This is not sharp. This is not dangerous. In theater, in big surgeries, we actually put like a plastic, a big thick plastic anti-slide thing on the patient's chest, and we have instruments on it. Like those doormat stuffs, but all plastic, and put it on the chest, sits on the chest, and we can put instruments on it. But this is not sharp. The two sections are not sharp. But you tell them that, look, we're gonna put this on your chest, is that okay? Is that okay? It's not heavy, is that okay? It's just very good for us, easy for us to use. We don't have to go back and forth, and I as a surgeon can reach it. Is that okay? It would be really nice if you can let me do that. And they say yeah. But if you don't tell them and you start fiddling on their chests, they get a bit nervous. So I ask consent for everything, all the time at every appointment. Even things that they have already given me written consent for, I go through that again on the day of. And I go through the steps. And they say, yes, you already told me, I know. I'm like, no, you need to, this is a new day. You need to know what I'm doing to you. So, and they go, yeah, sure, put the movie on. I'm here to watch my show. Any questions? No? Do you want to go play? I can show you this. You have